So prior to the early 1900s, healthcare in the United States was pretty much unregulated. And in fact, we had the most doctors per capita of really any other industrial country in the world. So we had kind of a robust medical system developing with lots of different schools of thought. There was competing kind of schools of thought in medicine of different ways of going about treating illnesses and things like that. And then what you saw is in 1910, the American Medical Association crafted this report and basically started lobbying state legislators and the government to say that we should only license a certain type of medicine, a certain school of medicine, and we ought to have all these kind of strict requirements for education and qualifications to be a doctor. And that's where you heard kind of these classic stories that you hear about snake oil salesmen going to these Western towns and duping people into these cure-all medicines. And for all intents and purposes, that's a fictional story that was spun up to gin up fear to pass these sorts of licensing measures. And what that did is it effectively over the next 10 years, so from 1910, the next decade, you saw literally half of the medical schools in the United States close, and you saw the number of doctors in the United States get cut in half. A lot of those doctors were minority doctors, Jewish institutions, a lot of female women doctors that got kind of elbowed out with the new licensing regime. And from that point forward, I think you have kind of a downward spiral where you have costs going up, but you have less access because things cost more. And so people are priced out of healthcare. So you have those massive supply restrictions with those licensing requirements in the early 1900s. And then you've coupled that. So jump forward to World War II, that's when we saw the real expansion of insurance. So during World War II, there were strong wage and price controls, and it was an attempt to help the economy, deal with the war and finance the war and things like that. But employers ended up offering bigger benefit packages in the form of health insurance as a way to attract potential employees. So they actually ended up lobbying the government, and the government ended up exempting all employer-sponsored health insurance from income taxes. And so that created this massive demand. And so employers said, hey, we can escape a lot of tax burden if we just offer bigger benefit packages, more comprehensive health insurance. And so that really boosted demand because the number of millions of more Americans were getting covered by insurance for all these different comprehensive healthcare needs. And so that really boosted demand. And so when you have a boost in demand coupled with restrictions on supply, you have a recipe for higher costs. And so, over the rest of the decade, you saw an increased, we saw Medicare and Medicaid get enacted that boosted demand even more. We saw other supply type restrictions like certificate of need laws emerge in the 1970s, which restricted supply of, medical facilities. And so that's all, kind of led to today where we have this situation where the United States spends the most on healthcare out of anybody else in the world. And, especially here in Montana, we actually have some of the highest healthcare costs in the nation. So from my mind, it's really driven by a crisis of supply. I think that's fundamentally where it is, but it's a vicious cycle because you have government restricts supply, but then it incentivizes and subsidizes demand. And so that's just a vicious cycle that leads to higher and higher prices. And really, there's no end in sight unless we can, develop alternative systems.